This is Diana Chen. Diana Chen is a volunteer and leader of the International Communication Department at NFCC, which is the Chinese Patients Organization. In her professional life, she's a data analyst with work experience at the Economist Group and KPMG. And I did a little math this afternoon. And in China, you have a population of over more than 1.4 billion people, if I'm right. Yeah. So
you're right.
I can only imagine the amount of NF patients you deal with over there. So I'm very grateful that you're here to share your story with us. Thank you, Diane. The floor is yours.
Go ahead. So good afternoon, everyone. It's really an honor to be here, and thank you, Karen, for giving me the opportunity to share my experience here. And as you said, I'm Deanna, and I'm a volunteer of NFCC, the Neurofibromatosis Shenzhen Care Center in China, and I'm also a parent of a girl with NF1 disorder. So today I'd like to share how we support the NF community in China through patient network management and the charitable clinics, and how I think some of our experiences may offer useful models globally. Yeah. So first, let me give a very brief introduction of NFCC. It was founded in 2019, and now we have grown into one of the most influential rare disease organizations in China. So as you might already know, there are approximately 600,000 people living with an NF disorder in China. I think it's the largest NF population in the world. Today, we are able to support over 20,000 NF patients and their families across all the provinces and regions in China. And our goal is to accelerate the access to scientific and continuous care for every patient. Yeah, so you can think that in such a large and diverse country, we are now facing two major challenges. One is that how to connect and support so many patients in different regions and with different socioeconomic conditions. Second is that how we can improve medical access and awareness in a system where rare diseases like NF are often overlooked, even by doctors, just like all the other diseases. Today, I will walk you through how we address both through online community building and our charitable clinic programs. So in order to manage our growing patient network, we now develop a three-tiered WeChat system. So WeChat is a little bit like WhatsApp. It's China's most widely used online messaging app. And at the first level, we have 15 general NF groups, each with around 500 members. And then patients can also choose to join regional or symptom-specific groups, for example, MPNST or scoliosis patients. And each new member is required to be verified to avoid misinformation or scams, which unfortunately are quite common in rare disease space. And now we have over 8,000 verified patients. And now we maintain a team of 10 trained volunteers who moderate and support the group daily. And they can also report the difficult cases or the patients who really need urgent help to leaders when necessary. So what are the benefits of this online community? I think first of all, this system allows patients to get immediate emotional support and quick answers to common questions, and of course also access to some more accurate medical information, which is often faster than a hospital visit in China. So we also use it to promote educational webinars and announce our charitable clinic events, and also share policy updates and also drug information. So what we see is, I think, when patients connect with each other and when they feel that they are accompanied by trained volunteers, they feel less alone and they are feeling like more empowered, and they can make better informed medical decisions than before. So I think that's the main benefits to the patients. And the second pillar of our work is that we organize charitable clinics in collaboration with hospitals. And in summary, we use two models. First, the first type of charitable clinic is that it's entirely NFCC hosted, where our team will handle everything, including patient recruitment, volunteer coordination, logistics, and communication. And the second type is hospital-initiated, where the NFCC we are invited as a co-organizer due to our strong network and event experience. So in 2024, NFCC have already organized over 70 charitable events across more than 30 cities. So in these free clinics, we ask hospitals to offer free medical consultations, patient education, and follow-up support. And of course, I guess everybody would like to know where does the funding come from. So the funding typically comes from three sources. First is pharmaceutical companies who usually sponsor educational sessions and sometimes the patient materials. And the second is that we will invite some charitable foundations who will fund mostly the free consultation services. And of course, for the co-hosted events, the host hospitals will also fund consultations and sometimes even some expensive diagnostic services such as MRIs and genetic testing. The events are promoted in our WeChat groups and on social media. So patients, they need to pre-register and submit their basic medical information to streamline their visit. And we usually hold clinics on weekends or public holidays so that they can be more accessible for working families and can attract more patients. I think based on our experience, a core part of our success in organizing free clinics is that we need to build strong relationship with NF-aware doctors. So in China, many doctors are not really familiar with rare diseases such as NF, so we focus on training them and empowering them. We identify NF-aware physicians, share training materials, and distribute NF patient handbooks that they can use in clinics. So over time, this collaboration have finally led into free clinic events. So in these free clinics, patients can have accurate diagnosis and treatment guidance and fast-track referrals for surgeries or imaging and prescriptions and personalized care. And sometimes we even ask for free services such as genetic testing and MRI, thanks to the persistent efforts of our volunteers. So these outcomes would not be possible without strong collaboration between the patient organizations such as us and the medical community. And for patients, we also have persuaded hospitals across the country to build MDT clinics, and it has been a game changer. So instead of navigating the healthcare system on their own, patients now can receive coordinated care from multiple specialists in just a single visit. So now MDT clinics for the NF are now available in 58 hospitals across 21 provinces in China, which means coverage in 2/3 of all the provinces and reaching approximately 85% of China's population. This rapid scale-up was made possible by the combination of doctor partnerships and patient community mobilization, and of course also support from local hospitals. So I guess everybody knows that the benefits of MDTs are very clear. Now patients can have more accurate diagnosis and faster access to treatment, referrals, and prescriptions, and also less stress for families. And also it gives us better opportunities for data collection and clinical trial recruitment, which are actually essential for research and the long-term patient outcomes. Yeah, I think that's all from my side today. And to close, I want to emphasize that while NFCC is deeply local, many of our strategies, such as moderated online groups and verified peer support and mobile clinic models, I think they can also be adapted globally. So we love to learn from your experience as well. And I'm happy to share more details if you have a question after the session. So thank you very much.